Hi, good evening, good afternoon, and good morning to all my viewers. I'm your host, Celesta Mary underscore RN, and today I'm continuing to educate you, rather inform you about vital signs. We have been learning about vital signs, and we started with the temperature. Remember, temperature is a very vital thing. That is why when you go to hospitals, you find the doctors or the nurses, the first thing before you see the main doctor, you are triaged. And when you're triaged, they take your vital signs. So, one of the vital signs that we learned last week was temperature. Why is temperature so important? We learned the importance of taking temperature, what temperature speaks to a nurse or a doctor about what is going on in your body, what temperature, what can alter the temperature of your body, what can make it to be so high, or what can make it to be so low. So today we are going to still on the series learning about all the vital signs, but today I'm going to talk about another vital sign that is very important. I want you to stay tuned. I want you to like my channel. I want you to subscribe. Go to Celesta Mary underscore RN and you will see other videos that you have shot with regards to health because your health is your priority and your health is your wealth always. So stay tuned as we learn today about the second vital sign that we need to know so that we are able to know what is it that our medics looking for whenever they insist on taking this before you're seen by the doctor. So stay tuned. Welcome back to my channel. I want you to go to my Facebook page, Blessed Celesta Bolo. I have my YouTube channel, Celesta Mary underscore RN. I also have my health, my wealth. Please subscribe, like, and share because these are important things that you can educate your people on the same. So we've been talking about pain. So what happens? You walk into a hospital and you meet the healthcare worker and they ask you, are you in any form of pain? So if you're not able to talk, how will they know? So we have different ways of conveying or communicating about pain. Pain can be spoken. You can say, I am in pain. And there are questions that a nurse or a healthcare worker will ask you. But we have people who are children. They don't know how to differentiate pain and they don't know how to differentiate the urge maybe to go to the washroom or the hunger pangs. So they might just tell you yes. So we have different ways that medics use to measure pain. So one of the ways that they use to measure pain that we use for children is facial. You look at the child. Children don't lie. When they are sick, they are sick. When they're in pain, and they will show it on the face. So we have different scales that we use, different faces, so you can tell if this child's face looks like this, the score is 0. If they are looking happy, they are playing all along, then it's 0. If you find them crying or they are grimacing, then you know. So you can rate using the uh, facial description of a child. What about people who can talk? With people who can talk, we use something we call numeric score. Numeric score is scoring pain between 0 to 10. Now, 0 means there's no pain, nada, there's nothing. But 10 means extreme pain. That is somebody who says, I cannot stand this pain. It is extreme. 10. So, as healthcare workers, we have different ways of intervening. We can intervene between 0 to 3. There is a kind of medication you can give to a patient between 4 up to 8, 4 up to 7, thereabout. There is an intervention you can do, but also to extreme pains of 8, 9, and 10. We also have interventions that you can give to patients with such scale. So it is important to rate, to be honest, to speak correctly. But again, the healthcare worker needs to know that they did not need to judge. Just because you broke your leg and you never cried and you're able to persevere the pain and you're only given a small painkiller doesn't mean that somebody else who come with a broken leg and is screaming, they are wrong. No, that is how they are telling you about it. So pain is subjective. It is he who has the pain who knows how much it pains. So the wearer of the shoe knows it best. And this is important for healthcare workers to know that the wearer of the shoe knows how much pain or how much it pinches. So we also have cases where we still have to score pain in patients who are in the ICU. These are patients who are unable to talk. They cannot tell you anything. They're in the machine, they're intubated, but you still have to score pain. How do you score such pain? So we have parameters that we use. And as I told you, it is important to score pain because when there is pain, some people's pulse rates increase. So their heart beats faster because the pain is too much. They cannot talk, they are sedated, they are paralyzed, they are in the bed, they cannot talk about, but they're in pain. So the only thing you'll find them, either the pulse will increase, their BP will increase, their respiration rate will increase. So there are things that can tell you, is this patient still sedated, still intubated? Are they on any painkillers? If especially maybe they went to theater or they have a condition that requires pain. So you'll find doctors and nurses having a regime for that patient who is unconscious. They cannot respond. But the machine or the vital signs that appear on the screen can easily tell you, I've done all this. Despite doing all this patient is still having a rise in BP. This patient is still having a rise in pulse. There is an issue. Pain could be the issue. So it's important to know that pain can affect the other parameters in the patient's body. Pain. So subjective, yet so important for us to know. And yet we need to be very honest and speak it so that it can be taken care of before we start overloading you with other things that shouldn't have, were it not just you told us that you're in pain. Women, we tend to have menstrual pain. So because we're used to it every month, you do go through your menstrual cycle, you might be a bit guarded and not, this one is, I'm used to it. But still it can affect your pulse rate. It can affect your respiratory rate. It can affect your BP. So it's important to always talk. And healthcare workers will always ask you, are you informed of any pain? It is the fifth vital sign that is so key and can be sorted out before anything else escalates further. Pain. Facial numeric rating of pain. Stay tuned as we learn more about pain. So welcome back to my channel, Celessa Mary _RN. I'm your nurse educator. I am a nurse mentor to many, and I would like to share with you about another vital sign. This is normally called as the fifth vital sign. However, it will be the second in my episode. Why have I chosen to talk about this vital sign in the second episode instead on the fifth episode? It's because this vital sign is key to know about all the other vital signs, or rather, it is an indicator of what is happening, or it can affect all the other vital signs apart from temperature. So what is this vital sign you're talking about? Pain. Have you ever gone to a hospital and been asked, are you in any form of pain? Did you know that pain is just an indicator that something is happening? You may feel you have a headache. You don't know what is happening. People have come to hospital with just mere headache, and then they've developed stroke. Some have come to hospital with headache, then it is found that they have something happening in the brain. They have migraines. So pain is an indicator telling us something is happening, something is wrong within your body. Remember, you're not born to come with pain, or rather, your body is not supposed to have pain as a default. You're supposed to be pain-free as default, as a normal human being. Why is it that important that healthcare workers, when you visit a healthcare facility, when a nurse or a doctor visits you in your home, they want to know your pain? Because pain is key. So let's learn. It is called the fifth vital sign by the healthcare workers. And I said why it's important for us to know pain before we know respiration rate, before we know pulses, before we know the BP or the blood pressure. Why? Because pain can affect all these other vital signs. A person who is in pain can, in a lot of pain, their respiration rate can increase. their pulse can increase, their BP also can increase. So before you take the pulse, you take the blood pressure, you take the respiration. It's always good to ask the person, do an interview. Are you in any form of pain? So that when you get a rise in these other vital signs, at least at the back of your mind can tell you there is something that is going on. This BP, this pulse is high. Maybe another contributing factor to it is that because of the pain that the patient is undergoing. So you are able to sort out the patient first before now you continue with these other vital signs. Or rather, you are able to help the patient and make sure that all their vital signs are normalized. Pain, very important. Now, one important thing about pain is very, very subjective. Somebody will come in the hospital who has just cut their finger, small cut, but they are feeling so much pain they cannot bear it. Another one will come out with a cut, even a deeper one, but they just be looking at you. People have got different ways to handle pain. People feel pain differently. And that is why, as healthcare workers, we are taught not to be biased. Because how somebody reacts to the same pain will be totally different. The way a child reacts to pain is different from the way an adult reacts to pain. And it's different from the way from an elderly person reaction to pain. Also, we find socio-culturally, there are people from other communities whose pain threshold is very what? Is very low. A small little pain and they are feeling it like in all extreme levels. So pain is so subjective. Some people feel more pain when especially they're going through other psychological issues. So a small trigger escalates the whole pain level. So as you are handling your patient, as you're going to the hospital, you need to tell the doctor about your pain. If you're in any form of pain, because pain will affect every other thing within you, will affect your physiological factors. Pain affects you emotionally. When you're in pain, even if you're told to wait for another patient, you might not be very patient to wait because it's the pain that is driving you. And as I said, different people react to pain differently. So stay tuned as we continue to learn about pain. The fifth vital sign after blood pressure, respiration rate, pulse, temperatures. After the four things, it is pain. But it is important to first learn about pain. Then we can now go to the blood pressure. We can go to the respiration and respiratory rates. We can go to the pulses. You can also go to SpO2. Pain. Stay tuned as we learn more about pain.